Good morning. If I could have everybody's attention, I'd like to call this joint hearing of the Human Services and the Health Committee to order. And if I might first ask everyone to rise for a Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, thank you. We're not going to take attendance today, but I thought what I might do is give the members that are present an opportunity to say hello and identify themselves and let you know where they're from. And if I might start off up top with Representative James.
Good morning, everyone. My name is Lee James. I represent all the folks in Venango County, District 64, plus a little bit of northeast Butler County.
Good morning, everyone. State Representative Tara Toohill, Luzerne County, 116th Legislative District.
Good morning, Jerry Mullery, Luzerne County, 119th Legislative District.
Christine Howard, the 167th District, which is in Chester County.
Good morning, Lori Mizgorski. It's the 30th District in Allegheny County.
Pam Delicia, I represent the 194th, parts of Philadelphia and Montgomery County.
Good. John?
Joe Hohenstein, 177, Philadelphia County.
John Hershey, 82nd District, Juniata, Mifflin, and Franklin counties.
Hi, good morning. Aaron Coffer, 120th District, Luzerne County.
Good morning, Jim Gregory, 80th District, Blair County.
Hi, Brad Royce, 6th Legislative District, parts of Crawford and parts of Erie.
State Senator Scott Hutchinson, 21st Senatorial District. I want to thank the chairman for accommodating Senate members and thank you for your invitation to participate today.
Good morning, Marcia Hahn, 138th Northampton County.
Good morning, Park Wentling, State Representative in the 17th Legislative District. I'm honored to serve parts of Western Erie County, Western Crawford, over towards real close to Venango County, down to the Middle Mercer, and a part of Lawrence. Thank you.
Thanks. Representative Dave Zimmerman, serve Northeast Lancaster County.
Good morning, Representative Madden, serving the 115th District in Monroe County.
Gene DiGirolamo, I'm the chairman of the Human Services Committee from Bucks County.
Representative Dan Frankel, Allegheny County. I'm the minority chair of the Health Committee.
Okay, terrific. Welcome, everyone. Good to see everybody here. Just a few ground rules before we get started. The agenda, we're going to have to try to keep the time limits on the testifier as much as possible. We have to be done this hearing by 1 o'clock because that's when session starts. So I'm going to try to finish like about 10 of 1, 5 of 1. We are not allowed by our rules to go past the time when session is on. So what I'm going to do is allow everyone to testify first to make sure everybody gets in because I know you've come from a lot of you from a long distance to be here. So we want to make sure everybody has the opportunity to testify. And then I would ask you, after you get done testifying, if you would stick around till the end, because then we're going to open it up for questions and answers from the members that are here today. And I'm going to let right now, just very briefly, the chairmen of the committee, the two committees, maybe just a few brief comments that they would like. But from my end, I mean, this is a very passionate and emotional issue. This really is. And it's an important issue to many of you here and many of you across the state of Pennsylvania. I would ask everyone that when the people are testifying, if we show the testifiers a certain amount of respect when they're testifying. So I'm going to ask you to please now not call out when the people are testifying. I think we have to show them that courtesy. And again, I realize this is really, really a passionate issue. And from my perspective, I mean, I think it's important that we hold this hearing. We've got a very fair and balanced hearing, and I want to thank the staff on both sides, Republican and Democratic staff, for all their hard work on putting this together. And from my perspective, I've got a lot of serious concerns about doing this. I really do. And I go back to just recently this issue with the sheltered workshops that was implemented the 1st of July. I understand there's a lawsuit that has been filed by some of the providers and some of the other groups around the state. And for me, I keep knocking up against that wall that the families should be the main people who should be making decisions for their loved ones. And I just can't get past that, whether it's a sheltered workshop issue or the closing of these 2 centers. I think the family should have the most say in what's happened with their loved ones. And that's what I just can't get past on why we're closing these 2 centers. So with that, I'm going to ask my other chairmen that are up here, Representative Zimmerman first, if you have a few comments.
Sure. Thank you, Chairman. Appreciate that. Yeah, so I'm sitting in for acting as health chairman here this morning in place of Representative Kathy Rapp, which would normally be here. So I'm just filling in for her. So I just want to make a couple comments. In my district in Northeast Lancaster County, we have 2 facilities, one called Lighthouse and another one is the Effort Area Rehabilitation Services. And both of them have 200 or in excess of 200 individuals and do an outstanding job working with these folks, generally, very vulnerable to whatever's going on around them when there's intellectual disabilities involved. But we met with staff many times in both these facilities, and they're just phenomenal individuals that thoroughly care about these individuals and their well-being. And so without those facilities in my district, I'm not sure what things would look like. So it gives me pause on the thought that we might close Polk and Whitehaven. And really at EARS, this, as we call it, the effort area facilities, we actually do case study work up there once a month, where we spend a day, have one of our staff up at that facility, so we can kind of interact with those folks and have families come in and so forth. And it's just been a great relationship, and I'm just impressed with the quality of work and the care for these individuals. So again, I'm very interested in hearing the testimony on both sides today, but really, I think the important thing is that somehow we find a way that these people are dealt with in a good way going forward, whatever that is. So thank you, Mr. Chairman.
Okay. Representative Madden.
Thank you, Mr. Chairman. I'm here filling in for Chairman Angel Cruz, who's unable to be here. I echo the sentiments of my colleagues. I attended the Whitehaven public policy hearing and heard the really moving testimony from the families of residents there, from the people whose job it is to take care of the people. And I understand that we have a waiting list of people that need to be served, and we have these 2 wonderful facilities, and I'm still trying to wrap my brain around why we would close a facility when we have a need, and certainly it's not a one-size-fits-all need. So I'm looking forward to the testimony and being able to make an informed decision. Thank you.
Representative Frankel.
Thank you, Chairman DiGirolamo, and thank you to everybody who will be testifying today. I've been here for now more than 20 years, so this is not the first time we've dealt with closing one of these centers, and I know how gut-wrenching it can be, and I understand that there are sometimes unintended consequences. So I am looking forward to hearing from the parties today. I can't stay beyond noon today because I have another commitment, but we'll follow this very closely and appreciate the opportunity to hear from all the parties who have an interest in this very serious and complicated issue. Thank you.
Okay, with that, I'm going to call our first testifier up, which is Kristen Aherns, who's the Deputy Secretary for the Office of Developmental Programs in the Department of Human Services, and would also like to recognize the presence of Representative Boback, Representative Heffley, Representative Cox, and Representative Kinsey. With that, Kristen, they've given me a box up here to keep time, so I'm going to try to figure out how to work it while you're talking. But
well, I hope you give me 2 minutes to figure it out, because I think I've got a little more than 5 minutes here.
You can begin whenever you wish, and again, I would very respectfully ask you to try to stay within the time frames as much as possible. Thank you.
Will do. All right. Well, good morning, Chairman Zimmerman, Chairman DiGirolamo, Chairwoman Madden, and Chairman Frankel, members of the House Health and Human Services Committee, and other senators that have joined us today. I am Kristen Ahrens. I am the Deputy Secretary for the Office of Developmental Programs within the Department of Human Services, and I thank you for inviting me to testify today. First, I'd like to begin by affirming 2 things that we all agree on. First, we believe that people with intellectual disabilities should be treated with dignity and respect and deserve compassionate, person-centered care that meets all of an individual's needs. We also know that our state centers deliver this care every day to their residents. The Wolf administration firmly believes that all people deserve the opportunity to live among their peers and their families in integrated supportive homes. The administration is leading with this philosophy through our work to increase opportunities for people with disabilities to live more freely in their community and still receive the much-needed supports. We do not take the decision to close Polk and Whitehaven centers lightly. All of us at DHS know that there are very strong, often competing perspectives on how we care for people with intellectual disabilities. I think it's imperative to think about this decision in the broader context of how this system has changed and stayed the same over the past century. Pennsylvania's state center system was designed at the turn of the 20th century, when institutionalization of individuals with intellectual disabilities was considered the standard of care. At the peak of institutionalization, we housed more than 13,000 people in our institution, in our state centers, and what were called MR or ID units in Pennsylvania. The majority of both Polk and Whitehaven residents that are there today were admitted during that time period. But the world has changed pretty dramatically since the 1960s. Back then, caring for a loved one with a significant disability for families who didn't have means was often impossible. There wasn't a community system or much of a community system to support people. In 1981, Congress enacted the Medicaid Home and Community-Based Waiver. At this point, sustainable funding for community-based services allowed states to invest in establishing strong infrastructure for those community-based services for people with intellectual disabilities and autism. The trend for deinstitutionalization accelerated throughout the 1980s and 1990s. Today, Pennsylvania serves more than 40,000 people in community settings. More than a quarter of these people receive services 24/7, residential services very much akin to what is provided in our state centers. Backed by federal and state law and policy, parents today expect inclusion as much as possible and individualized supports to allow for that. The millennial generation grew up sharing classrooms and extracurricular spaces with children with intellectual disabilities and autism. That's the standard now, and that's what they are expecting for their own children. Today, institutionalization is now a temporary or last resort option for care. Pennsylvania does have a waiting list for services for people with intellectual disabilities and autism, but it is not a waiting list for state centers. People are specifically waiting for home and community-based services. When a person or their family member applies for services, they are provided a choice between intermediate care facility or community-based services. The 13,000 people that are on the waiting list today have selected to wait for community services instead of taking that option for an intermediate care facility, in spite of the fact that there are about 100 vacant beds today in our intermediate care facilities. Today, we operate just 4 state centers with approximately 700 residents. Each year, this number continues to decline because we have aging residents who pass away and people do move to the community. Admissions happen infrequently because alternative options are available in people's homes or elsewhere in the community. As the census declines, obviously the cost of the facilities grows. The cost now hovers at between $400,000 and $450,000 per year per person in our state centers. In May, the House Human Services Committee held a hearing on the state center system and expanding admissions. DHS was not invited to testify at that hearing. I'm aware that following the announcement to close Polk and Whitehaven centers, the call to reopen the doors for the state centers really began in earnest. DHS does not control state center admissions. State center admission policy is governed by interrelated statute, regulation, and case law. Statutes include the Mental Health and Intellectual Disabilities Act of 1966, the Guardianship Statute, which does not allow a guardian to voluntarily admit a person to a state center, and the Federal Americans with Disabilities Act. So admissions are managed through a process that was established in regulations. The regulations are Chapter 55, 6250, which followed a 1976 court decision, which requires that a court determination, for anyone to be admitted to a state center, demonstrating that a person cannot be served in their home or community. This is also consistent with the United States Supreme Court's decision, the 1999 Olmstead decision. This decision to close Polk and Whitehaven centers was not made to disrespect families' wishes. The centers may be the only home that some of these individuals have known. Families chose the center because it was the best option available at the time. I need to acknowledge this because myself and everyone at DHS understands the gravity of this decision. At the same time, given advances in developing the community infrastructure that I've discussed and the wide array of options that are available in the community, we see very low admissions to the remaining state centers. And 4 state centers are no longer needed to serve this population's needs. We are confident, based on our experience with the Hamburg closure, that the needs of the state center residents will be served just as well, if not better, in the community. It would be irresponsible to make these decisions based on emotion. We have a responsibility to our families, the residents, the staff at each of these facilities, and also to all Pennsylvanians. And we need to consider the sustainability of this system as it stands. If we don't make this decision now, then at what point? When there's 50 residents, 20 residents, 10 residents, 1 resident? With each drop in the census, the cost does rise. That is more funding that cannot be redirected to help people seeking services in the community or people who are on ODP's waiting list. The more money we spend on serving people in state centers, a level of care that is available in privately run community facilities, the more people have to wait for services. I want to be clear, the decision is also not a slight on the quality of care in the centers. The 1,179 employees of our state centers provide exceptional loving care to the residents of Polk and Whitehaven every day. We're committed to working closely with these employees over the next 36 months to help counsel them towards employment opportunities and with the Commonwealth or with the private providers that ultimately may serve many of these residents. All former Hamburg State Center employees who expressed an interest in continued state employment following the closures of Hamburg were offered jobs with the state. As we move forward with this process, I hope that all of us, members of the General Assembly, advocates, stakeholders, and families, can work together as partners. Through our experience with the Hamburg closure, we know that is possible. Families who never imagined their loved one could live in the community found placements that exceeded their expectations. And for the first time in their lives, residents had homes that they truly understood to be their own. These are not just my words. This is actual experience that we heard from individuals and families that were formerly residents of Hamburg. As part of your packets, I believe you have letters from some of those same residents of Hamburg and their family members. So I know this is a difficult decision for many people affected. It's why we're committed to counseling residents, their families, and staff through every step of this process. We began meetings the day of the closure, and those continue regularly right now. DHS will not abandon anyone throughout this 36-month closure process. Thank you for the opportunity to testify today. On behalf of all of us at DHS, I look forward to working with you on moving this forward.
Okay, Kristen, thank you, and if you would be able to stick around for a little bit, so if there's some questions at the end, we would very much appreciate it.
All right.
Okay. We have a panel next, and I would ask them to come up. We have Sherry Landis, who is the Executive Director of the ARC, Jamie Ray Leonetti, who's Associate Director of Policy for Temple Institute on Disabilities, Jackie Beilhartz from the Disability Rights Network, Marian Baldini, President and CEO of Kencrest, and Gary Blumenthal is the Vice President, Government Relations and Advocacy for Envision Human Services. And I'd like to welcome everybody. And again, I'm going to ask you to please try to keep your testimony within the 5-minute limit. If you look on the table where on both corners, there's a green light, and then when you get close to the 5 minutes being up, you'll see the red light go on, so that way you'll know that your time is up. And we're going to start with Sherry Landis first from the ARC. Sherry, you can begin whenever you'd like. Thank you.
Thank you. As you can see from my notes, I had to abbreviate once we got the 5-minute warning, so I will try to be brief. I want to thank everyone, Chairman, for having us here today. As you know, my name is Sherry Landis. I'm the Executive Director of the ARC of Pennsylvania. For the past 70 years, the ARC of Pennsylvania, its 33 local chapters and 8,000 plus members have worked to ensure that children and adults with intellectual and developmental disabilities receive the support and services they need, are included in their community, and can have control over their own lives. The ARC of Pennsylvania applauds Governor Wolf, Secretary Miller, and Deputy Secretary Ahrens on the decision to close the state centers at Polk and Whitehaven and to transition all current residents to their local community over the next 3 years. The ARC of Pennsylvania has stood with families who rejected the notion to institutionalize their child, families who created services when no other services existed, and families who decided to move their family member out of a state center. The ARC of Pennsylvania stands with families. We know that families are an integral to a successful transition, and we are committed to supporting individuals and their families in whatever way we can to make this a successful move from an institution to their own home in a typical community. Having attended the Polk and Whitehaven Act 3 hearings and subsequent hearings on this issue, it is evident that many of the people in strong opposition to the closing of Polk and Whitehaven centers are the people who make their living there and people who have concerns about the community system. Let me address these issues in greater detail. Issue 1, why was the decision made to close 2 state centers when there is a long waiting list that exists right now? There is a misunderstanding about the waiting list. The current waiting list is a list of 13,000 people. It is a list of people waiting for community service, not state center services. Just opening up the state center will not address this waiting list. People already have an entitlement to state institutions, but people don't want those services. That's why they're on waiting lists for community services. And similar to the closing of Hamburg, no person from Polk or Whitehaven will be added to the waiting list. Issue 2, why move people to a community system that has a high turnover and low paid staff? The community system currently serves well over 55,000 people in a variety of locations with a variety of services. It is heavily regulated, and monitoring and oversight by various systems are utilized to assure safety. We know that there is not a system that is perfect. We know health and safety incidents occur to people living at Polk and Whitehaven. When one looks just at the numbers of reported incidents, it appears the incidents are higher for people living in the community as compared to the number of incidents of people living in the state centers. But it's a false comparison. The centers serve roughly 700 people, while the community serves over 55,000. We also know that people with disabilities are safer when they live among their families, friends, and community members, and others that take care about their dignity and safety. Research shows that people are safer in the community because there are more sets of eyes who see the person. When the community staff see you every day, abuse is more apt to be spotted and action taken. When you're an institution, only the state center staff will see an individual. This is not a commentary of the very good people who work at the state centers, but it's human nature. This is why the child welfare system no longer places people or children in orphanages. Despite the imperfections of foster care, this committee would never argue an orphanage is a better place for a child. Issue 3, the argued disparity between wages earned by state workers in the institutions versus DSPs working in the community are indeed documented. But I would be remiss if I did not reiterate that the General Assembly has direct impact on the wages of DSPs. The ARC of Pennsylvania has and continues to ask the legislature to address the direct support professional salary issue to promote quality. You have the ability to improve DSP compensation and not use it as an excuse to keep people with disabilities needlessly institutionalized. Issue 4, the closing of Polk and Whitehaven will result in people living on the streets in local prisons. Unfortunately, politicians and those in media often confuse state mental hospitals with state centers for people with ID. They are very different systems. Some deinstitutionalization of people with mental illness may have occurred in the 70s without sufficient community-based capacity, but it has never been the case that state centers for people with ID were closed without proper planning, community service capacity being in place for people returning to their community. No one from Hamburg ended up in prison or living on the streets.
Sherry, I'm going to have to ask you to try to finish up your pitch.
Once again, thank you for this opportunity to present the views of the ARC of Pennsylvania. It's 2019. The debate about institutions and whether the community is better was over decades ago. It's sad the debate is resurrected and one of the few remaining institutions are slated for closure. Quite frankly, it's embarrassing that Pennsylvania still operates state-run institutions for people with intellectual disabilities. We applaud Governor Wolf and his decision.
Okay, thank you. Before our next testifier, I'd like to recognize Senator Muth, who's here in attendance also, and Representative Klunk is also here in attendance as well. I did that. Okay, next we're going to have Jamie Ray Leonetti, who's Associate Director of Policy for Temple Institute on Disabilities. Jamie, you can begin whenever you'd like.
Thank you, Chairman DiGirolamo, and thank you to the members of the Health and Human Services Committee for the opportunity to provide testimony here today. My name is Jamie Ray Leonetti, and I am the Associate Director of Policy at the Institute on Disabilities at Temple University. The Institute is Pennsylvania's University Center for Excellence in Developmental Disabilities, or what we call a UCED. We are a Center for Excellence in Developmental Disabilities, Education, Research, and Service, and we are a statewide program. We are one of a network of 67 centers that are funded through the Administration on Intellectual and Developmental Disabilities within the United States Department of Health and Human Services to conduct training, service, technical assistance, research, and dissemination activities on behalf of people with developmental disabilities in this Commonwealth. The Institute has been Pennsylvania's UCED since 1973. Since 1999, the Institute on Disabilities has collaborated with the Pennsylvania Office of Developmental Programs, ODP, to conduct and analyze data from Independent Monitoring for Quality, or what we call IM4Q, a statewide initiative to assess the quality of life of people with intellectual disabilities and autism in Pennsylvania. This initiative is part of a national effort called National Core Indicators, in which 46 states participate. Through National Core Indicators performance data, indicators have been developed and states measure their performance on these indicators. In Pennsylvania, data are collected from a representative sample of individuals living in a variety of settings, including family homes, their own homes, group homes consisting of 1 to 4 and sometimes 5+ individuals, public intermediate care facilities for people with intellectual disabilities, ICF or IDD centers, private ICF IDD centers, and life-sharing situations. The data are collected through interviews with individuals with intellectual disabilities and their families. Trained teams of individuals conduct the interviews, and each team includes at least one person with a disability or a family member. The data are collected by nonprofit organizations who are free from conflicts of interest, meaning that they do not provide any waiver services. The Institute on Disabilities analyzes the data, and reports are issued for the statewide sample and for each of the 48 intellectual disability programs across the state, as well as for the state centers. As of the most recent data, what it shows from 2017 to 2018 is that people living in public ICFs were slightly more satisfied than in other settings. However, with regard to dignity, respect, and rights, the people in the public ICFs experienced less dignity than any other group other than private ICFs. The data are even more troubling, though, with regard to choice and inclusion, where the state ICFs scored significantly lower than any other group. In addition to the data mentioned, contrary to popular belief, it is not the people with mild disabilities that are most likely to succeed in the community, but rather people with the most significant disabilities. As the Pennhurst study showed, there was no one for whom a community placement was not possible. As a corollary to that, I was once told that for every person living in an institution, there is a similarly situated person living in a community program. And I would like to add to that corollary by saying that for every person living in an institution, there is a similarly situated person successfully in the community, and a similarly situated person who is living at home with their family. With regard to data at the national level, according to the State of the States in Intellectual and Developmental Disabilities, the population of state institutions has decreased by 12.7% nationally and by 9.4% in Pennsylvania, With 4 institutions open in Pennsylvania, it is in the top 50% of states with institutions. The annual cost of supporting a person in a state institution is $255,692,000 nationally, and over $300,000 in Pennsylvania. It has been suggested that Polk and Whitehaven could be downsized or used for things such as respite. And to that end, I say ask the families, but not the families of sons and daughters who live in institutions. Ask the families of sons and daughters who have kept their family members at home for 20, 30, 40, and 50 years. On the other hand,
Jamie, excuse me, I'm going to have to ask you to wrap up, please.
I'm almost there, Representative. Thank you. I am sure that none of these families would find a state center to be a suitable place for their relative, even for a short weekend. Thank you.
Okay, thank you. Next, we have Jackie Bell Beilhartz, who's from the Disability Rights Network.
Thank you very much. I'm here reading the testimony of Ms. Judy Banks, our Deputy Director. Thank you for inviting testimony from Disability Rights Pennsylvania on the closure of Polk and Whitehaven centers. Disability Rights Pennsylvania is the designated federal protection advocacy system for Pennsylvania. We have been the federally mandated protection advocacy system in our state for over 40 years. Our mission is to protect and advocate for the rights of persons with disabilities so they may live the lives they choose, free from abuse, neglect, discrimination, and segregation. Our vision is a commonwealth where people of all abilities are equal and free. Disability Rights Pennsylvania supports the decision of the Pennsylvania Department of Human Services to close Polk and Whitehaven centers. Pennsylvania has a long and successful history of closing state centers and supporting community integration of people with intellectual disabilities. Through several closures of state centers, I've been directly involved in helping individuals and their families with their transition planning in preparation for individuals moving into the community. I witnessed firsthand the wonderful and positive transformation of lives and was encouraged by their resiliency and determination to enter a new phase of their lives. With Hamburg being the most recent state center to close, that closure empowered 80 people with the choice to live in the community, a place where we all live. During the Hamburg Center closure, individuals and families became better informed about the closure and transition process and their essential role in those processes. Family members and individuals were given extensive information about community services and supports and opportunities to explore community, residential day and employment options, meet provider staff, visit community programs, and to learn about health care access and health care providers. In the end, about 50 people and families chose community living. However, all voices were heard, honored, and respected throughout the closure and transition process. Under the system set up by the Pennsylvania Department of Human Services, if, after being engaged and informed about all of the options for community living, the person decides they want institutional care, they can still make that choice. However, it is inaccurate to say that individuals with intellectual disabilities and other disabilities cannot live in the community. For every person who resides in Polk and Whitehaven centers, there is a peer in the community. With appropriate supports and services, all people with disabilities can live successfully in the community. 96% of people with intellectual disabilities who need services receive those services in the community. These individuals have varying degrees of behavioral health, physical health, and communication needs. One voice that I'd like to include in my testimony at this time is the voice of a man that lived at Hamburg Center since he was a child and who chose to live in the community. This is Gordon Bensing's statement. Thank you for inviting us here today. I've been involved in advocacy for many years and appreciate the opportunity to speak here on behalf of all individuals with special needs. Peter and I lived at Hamburg Center since we were children, and I became involved early on in the plans to relocate its residents and close the center. We would like to thank the many people who cared for us at Hamburg Center over the years. They did a fantastic job, and we will be forever grateful for that care. Through Accenture Human Services, Peter and I moved into our new home in Lancaster County on June 27, 2018. We each received a key to our new home and quickly adapted to our new lives in the community. We each have our own rooms and got to choose the paint color. I chose blue and Peter chose pink. I have always wanted a pet, and in December I purchased a cockatiel, which I named Frankie, after one of my good friends at Hamburg. She brightens my days with her endless whistling and talking, and has even learned to say, "Love you, Gordy." Peter has a beautiful fish tank in his room, which we have to turn off at night so he doesn't stay up all night watching the fish. We are able to spend our days lounging in the sun on the back deck, working in our little vegetable patch, visiting with friends and neighbors, walking in the park, going to church or community events, bowling, fishing, watching football and sporting events in our man cave, and shopping as we please. It is our choice what time we want to go to bed and what time we want to get up, what music or movies we want to play in our own rooms, and even what flavor beer we want to drink while watching the game. Our favorite is Angry Orchard. I was asked to speak about how life has changed since moving into the community, but I only have 5 minutes, so I will highlight the most important. The biggest difference has been the change in Peter's and my health. I was in and out of the hospital on almost a monthly basis, but since moving in June of 2018, I've only been admitted to the hospital once. The same goes for Peter. His health is much improved, and in fact, after being unable to eat or drink anything by mouth for almost 20 years and receiving all sustenance and fluids with a feeding tube, Peter is now eating and drinking, much to his enjoyment, and has had his feeding tube removed. I am still unable to eat anything by mouth, but I do get to do tastings. I tried cotton candy for the first time in my life, and man, was it good. Angry Orchard doesn't taste too good, but that's okay. I want to advocate for other individuals still living in institutional care to have the chance to experience the richness of life that we have had since moving to the community, to advocate for the same rights for all people, no matter their special needs. In closing, let me say how thankful we are to be here today, and even more, how thankful we are for our home with Accenture Human Services and to be part of a community where we feel valued and included. Have a great day, and don't forget, go Eagles or go Steelers. That's from Peter.
Okay.
So
Thank you very much.
I'm sorry.
I'm
Let
going to
me
have
just-
to
can I
ask you to, Jackie, please wrap up. mean,
I will.
we're-
Segregation of people with disabilities is contrary to actualizing the civil rights of people with disabilities. For the first time, many individuals living at Polk and Wayhaven centers will be able to do what you and I take for granted: live in a house that they can call their own, choose where they will live, nearby family and friends if they choose, have a say with whom they live, have wide-ranging options for social and recreational participation, go grocery shopping and choose what they will eat, where they will live, how they will spend their days, evenings, and weekends. The possibilities are endless.
Okay.
Thank you.
Thank you. And before we continue, I'd like to recognize the presence of Representative Nelson has joined us, Representative Oberlander, Representative Mostello, and Representative Todd Pollinchuk has also joined us. Okay, with that, Marion Baldini, who's the President and CEO of KenCrest, you can begin whenever you'd like.
Good morning, and thank you for the opportunity to speak today. I'll talk really fast and try not to go over the limit. My name is Marion Baldini. I started working in the field with directions from my grandmother that all people with intellectual and developmental disabilities belonged in the community. I have over 45 years of leadership in this field and currently serve as the CEO of KenCrest. For over 114 years, KenCrest has served the community. Most of those years were dedicated to supporting children who were not developing as expected and supporting adults with intellectual disabilities. We serve over 12,500 people on an annual basis. 150 community group homes are in our scope of business. Our mission is to help serve people to thrive as our neighbors with or near their families and receive support in their own homes through positive person-centered approaches. Throughout my career, I've been responsible for transitions for multiple institutions, including Elwyn, Pennhurst, Embryville, and the Hamburg Center. The teams I have led invested countless hours to ensure that these transitions have been impactful and effective. It's been more than a few years since we started the work in support of the transition of the residents at Hamburg Center. Of specific interest to the Department of Developmental Programs was our success in supporting individuals with significant health concerns. At that time, Kencrest operated 4 highly specialized homes for individuals with complex medical needs requiring 24/7 nursing care. And those were for children or adults. The process that was rolled out by the department engaged us right away in meeting and speaking with families. We were directed that proposals would be required, which would show our interest and our capacity to serve the individual in their lives, and those families would need to approve those proposals to move forward. We shared our capacity to serve, and we want you to know the specific responses of the families as we first started working with them. One family was immediately interested in the proposal. The balance of the families were not. Most were skeptical. A few were willing to see what we could offer directly for themselves. Others were interested in the opinion of the social worker with whom they had a trusted relationship at Hamburg. So either the family or the trusted social worker visited our homes. All of the families who saw what we had to offer or consulted with the social worker agreed to review our proposals. Those proposals took many hours to develop as we got to know the individual's needs, talk with the staff, review their records, and become truly confident that we could make a difference in those folks' lives. We drafted 10 proposals. 8 of those proposals were accepted by the families. After we reviewed those proposals and had them accepted, we deployed staff of nurses and professionals to continue to visit these individuals and follow them along with the Hamburg staff to make sure that we could continue to meet those needs. And that assured both the Kencrest leadership and ODP that we would be current when those individuals were ready and their homes were prepared for them. Since then, many of these individuals have progressed in their health and social interactions, and we're discovering their interests every day. The community has rallied around them. All of those residents have strengthened their connections with their families. We're expecting trick-or-treaters again soon at all of our homes, and we give out candy while encouraging and educating our neighbors on the care that is being provided for each of these individuals, and to show the value of the life of people who are different but important to all of us. We know how to staff these homes. We have nurses 24/7. We have a primary physician who got to know them while they were at Hamburg, who continues to make the old-fashioned house call as needed. We know how to adapt environments to support complex needs and how to make a welcoming home with a few things like a track system for barrier-free support. I understand that weighing of conflicting interests is difficult, but I have to tell you that some of the choices that we have today were not available when these folks originally went to these institutions. I have lost track of the number of parents who told me during my career that they were advised that an institution was the right choice or the only choice, and in fact, in those days it was true. We have learned and developed since then, and we know the real value of inclusion. What matters most in transition planning now is learning, discovering what is possible, and mobilizing our resources to create something special. We accept that responsibility to ensure that everyone is in our care has quality no matter what their ability, and supporting people to live out their lives in the most meaningful and fulfilling way. And this is by pursuing a choice and knowing what those choices are, which means immersing people into community and a place close enough for their family to spend time with them. We were excited to hear that the staff who supported the Hamburg transition from ODP were going to continue to provide the same supports to the families of Polk and Whitehaven folks. We invite the members of the committee to visit Kencrest community homes that specialize in people with medical needs. Over the past year, we've had multiple legislators visit these homes, and each was extremely impressed with the high level of quality. On behalf of Kencrest, thank you for listening and for allowing me time to lend the voice of success for those people who are now living as our neighbors.
Okay, Marion, thank you. And next, Gary Blumenthal is the Vice President, Government Relations and Advocacy for Envision Human Services. Gary?
Thank you, Mr. Chair, Madam Chair, and other assorted chairs and members of the committee. I understand the perspective you all are coming from. I'm a former legislator. I have participated in the closing of state institutions in other states, and I understand the challenge you have in front of you. I also respect the feelings the expertise of the Polk community and the Whitehaven community. I believe those people have provided excellent care for people under their charge. I also think that it is critically important that we look at the entire array of people in need of services in this state. I'm not going to read my testimony to you. As a former legislator, I know you can read, so I'm not going to read it to you. I am going to hope that you'll look at the data that I have in my testimony and the data presented by my colleagues here that validate that quality care equal to or better is available in the community. I want to address the biggest elephant in the room. The biggest elephant in the room here with respect to why this is happening, why the department has made this recommendation, why people are coming to you, is the fact that you, as a General Assembly, this administration, prior administrations, have established a multi-level system in this state. You have established state institutions, you've established community programs, and you have funded them at significantly different levels. You have a state center system that costs $435,000 to $450,000 to support the people at Whitehaven and Polk centers. And you have 13,000 people on a waiting list. We would not be here were it not for the fact that you as a Commonwealth do not and have not provided the sufficient revenue to support the system that is in place. As a result, when you make a decision to keep a 2-track or 3-track or 4-track system that has some people who are more valued, and they have a support system of $435,000, what are you saying to the families of 13,000 people, many with the same disability profile, who are going without services? You may be receiving hundreds of calls from people who are upset about Polk and Whitehaven closing. There are 13,000 people who are struggling to get through the day supporting their loved ones who cannot make the calls to you. But when you make the decision of how you're going to spend revenue, you do that each year. You also direct ODP and DHS to live within its budget. You tell them when they're putting together budgets to live within that budget, come to us with cost savings. And then when they come to you and say, we have a difficult choice, that we're operating systems that have identical people with identical needs with the same level 6 and level 7 disability profiles, but one we're going to give a significant amount of revenue to, and the other we're going to keep a 13,000 person waiting list. I don't know how that can be justified. If you decide to keep these centers open, you may do so. But tell me what your response is going to be to the 13,000 people who are suffering at home, who also have aging parents, who have siblings that will die as well, who aren't receiving any services at all. I did see that you have proposed a bill that apparently is going to be acted on today or tomorrow that essentially says until everyone receives HCBS services who are on the waiting list, you won't allow closure of the ICFs that are proposed for closure. What is the price tag of this? If you have let 13,000 people, and that list of 13 was 14,000 2 years before, 15,000 prior to that, 20,000 prior to that, you're going to fund everyone on the waiting list. Are you going to do that? Because that requires a significant use, effective use of dollars, and it requires significant tax increases. Well, I'm a Democrat from Kansas, and I voted for virtually every tax increase that came in front of me. I look forward to the day when this General Assembly does the same. So you can support the people who are in need, support the families that are desperately crying out for supports and services. I don't diminish the concern, the love, the support the people of Polk and Whitehaven feel for the people they support. But when you continue to operate these programs ad infinitum, you are setting up these people at Polk and Whitehaven to come back year after year, because successive legislators will also look and say, successive governors will look and say, what is the cost? Why do we have these two separate tracks that are operating? And they will say, we need to look at cost efficiencies. So I don't know that you're helping families by continuing with a system that is so disproportionate in terms of the amount of dollars it supports. You're setting up these families to come back year after year to continue to fight to keep a system that is diminishing in people that want to come
Gary, I'm
to
going to
that
have
system.
to ask you to wrap it up, please.
I will, sir. I hope before you enact this legislation tomorrow, you understand the cost implications of it. And if you decide you want to fund the waiting list, fund direct support professionals who are living on poverty wages, and you want to operate these state centers, put your votes behind the revenues that will be needed to do this. Thank you.
Okay. Thank you all to the testifiers.
I got you, Joe.
Okay, I'm going to ask our next panel to come up, which is Susan Jennings, who's the mother and co-guardian of Joey from Whitehaven Center, and Irene McCabe, who is the president of the Polk Center Parents, Friends, and Family. And I understand Tom is not going to testify. Is that correct? Today?
Come on, Tom.
What was that?
Were you not going to testify today?
If I can.
Why don't you come up? We'll give you a couple minutes if that would be okay. We'd love to have you.
I got one page.
Okay, come on up. And I'm going to ask Tom if you would go first. And again, ask the panel to please stay within the time frames. And if you look on the corner there, you'll see a green light, and then when it gets close, the yellow light will come on. Tom, when you're ready.
Hello, I'm Tom Kashedas, president of the Whitehaven Center, Relatives and Friends, the family organization of Whitehaven Center. More importantly, I'm the son of a bartender, a man who quit school at the age of 12, worked in a breaker, worked in the mines, lost his leg at the age of 22. Then he became a bartender, and he educated 3 kids. Thank you for the opportunity to come before you to express my opinion on the closure of the state centers. Over the past 40 years that our daughter has been a resident of Whitehaven Center, some advocates, I'll call them the coalition, have waged an effort to remove our residents from their home, which is Whitehaven Center, a number of times. Some by choice and some by a forced decision. They have almost achieved their goals except one, and that is to close all state centers as a matter of a philosophy that was born out of the loins of the liberal leadership of the Temple University Institute on Disabilities. Over the years, our state center facilities have come a long way to excel in professionalism, care, and services to those who suffer from intellectual and developmental disabilities and autism. Today, the residents who are there, they and their guardians and substitute decision makers choose to live on a campus-like community with a lifestyle where all the required services are met for a quality of life that they choose and deserve. The Olmstead decision actually gave self-advocates a choice as to where they wanted to live. Sadly, Olmstead also gave states some latitude here when making policy. The policy established in Pennsylvania is to push all those seeking residential services into the community or private facilities. Families are not given the opportunity to even tour a state center today. In the meantime, the waiting list for residential emergency services that are offered at our state centers continues to grow for the citizens of Pennsylvania seeking those services, while empty certified beds at state centers total over 940. Today, they come to do battle. Today, we come to do battle for the lives of our loved ones and those on the waiting list. First, Know Your Foe, the Coalition, Temple University Institute on Disabilities, the ARC of Pennsylvania, Achieva, Disability Rights of Pennsylvania, the Waiting List Campaign, Speaking for Ourselves, Self-Advocates United as One, Vision for Equality, and Northeast Pennsylvania Inclusive, just to name a few. Secondly, the closed-door policy initiated by ODP is not working. The waiting list for residential services keeps on growing and growing. As we leave here today, the answer is simple. Just open the doors to our treasured state centers and let people make their own informed choices for services that they need. And open the doors, open the doors, open the damn doors, and eliminate the waiting list.
Okay,
That's all I got, sir. Thank you
thank-
very
thank-
much for the opportunity.
Thank you, Tom. Next, we're going to have Sue Jennings.
My name's Susan Jennings. I'm the mother of a severely autistic young man with intellectual disabilities and comorbid psychiatric disorders named Joey. Unfortunately, he is not an anomaly. He is not a one-off. When deinstitutionalization started in the 1960s, only 1 in 10,000 births were autism. Today, it's 1 in 59. And they're coming of age. 40% of the DHS caseload is autism, 80% of them are children under the age of 18, and they will be coming of age in the next 10 years, and they will need intensive services. Between 10 and 50% will be just like my son. Anyway, he began by living in the community, freely in the community, in the group homes, and in the short space of 4 years' time, he was discharged from 6 different group homes who could not manage him. They Section 302'd him into psychiatric wards. One of his stays was for 6 months because he had nowhere to go. It's particularly ironic for me to hear from Ken Crest and Envisions. Ken Crest refused him admittance, and Envisions told me they couldn't manage him. While he was in the community group homes living freely, he was toxically over-medicated, which left him with Parkinsonian tremors, serotonin syndrome, disfiguring female breast. He was never more isolated and never more segregated than in the community. They put him in one-person group homes. He was so lonely he'd call us up to 18 times a day. He was finally rescued by the professional and therapeutic environment of Whitehaven Center with its skilled, caring staff and its multidisciplinary teams of nurses, doctors, behavior psychologists, therapists, dietitians, and supervisors. Whitehaven gave him opportunities to socialize at dances, barbecues, trips to restaurants, movies, and amusement parks. There exists no equivalent services in the community. It just isn't there. Now, he's one side. He's the autism side. The other side are the elderly, medically fragile people who've lived at Polk and Whitehaven for 30, 40, 50 years. They are subject to dying of transfer trauma if they're moved out. 15 out of 80 of the Hamburg residents died. That's close to 1 in 5 people died when they were moved away from Hamburg. ODP considers that a great success. That everyone else is appalled by that. That is simply not acceptable. Now, the department will tell you that none of the 13,000 people on the waiting list want services in the intermediate care facilities of the state centers. I know, and my husband knows, that as a family, we were kept in the dark as to what ICF care meant, that the state centers even existed. We were simply had a paper pushed in front of us, and we said, check off the waiver box. And when I said, what are these 3 little letters, ICF? She said, that doesn't apply to you. So I unwittingly and knowingly signed away my son's legal rights to ICF care. When I later found out accidentally from my own research about the state centers, the social workers told me in no uncertain terms, those are closed to admissions and you can't get in. Now, I am calling upon our legislators to please investigate the waiting list of 13,000 people and find out How many of those families were never told what an ICF was, were never told about the existence of state centers, and were never given any real choice? This needs to be exposed. Secondly, the assertion that the money taken from the state centers can be used to substantially reduce or eliminate the waiting list is demonstrably untrue. In 2016, when Governor Wolf poured an extra $196 million into community services, and that's $58 million more than the state centers altogether spend, they only removed 39 people from the waiting list. I don't know where the money went. You are told by the department that the state centers are not sustainable. But what do they mean by sustainable? Polk Center has sustained itself for 120 years, and Whitehaven has sustained itself for more than half a century. All 4 state centers account for less than 7% of the office ODP budget, and they are more efficient, provide superior comprehensive services, and they can pay higher wages and benefits to their stable professional staff than the community. All of this fiscal efficiency is achieved by the state centers in spite of the policy of closed admissions. It is the community system which is unsustainable. They eat up over 93% of the ODP budget, and yet they cannot staff their waiver homes. They lack 11,000 direct support personnel for each shift. They go in and out of business. They neglect to report critical incidents to state authorities, resulting in multi-million-dollar lawsuits against the state, such as the $4.5 million lawsuit being battled in Oregon, where DHS Teresa Miller presided over ICF closures 10 years ago. The department and the advocacy groups will tell you that shutting down good institutions like ICFs is the historical trend. They exaggerate. 39 states have wisely retained their ICFs and are in compliance with Olmstead. With over 900 certified empty beds at the state centers, why close them when they have the experience and skill to provide needed services for the 13,000 on the waiting list and for the coming tsunami of young autistic adults coming of age? Why evict the 300 residents who love and appreciate the state centers? Open the centers to voluntary admissions. It's declined by design. The census numbers have been declined by design, not by choice. I implore you to sponsor and support House Bill 1918, the moratorium on the closure of Whitehaven and Polk centers until a thorough study and investigation of all the grave consequences of this decision is taken. Thank you.
Okay. Susan, thank you. Next, Irene McCabe, who's the president of the Polk Center Parents, Family, and Friends.
Thank you so much. I really don't know how we came to that. Thank you so much. It's so divided. I feel this division, and I want to apologize. I mean, I want to apologize because I don't know how we got to be so divided over something like caring for the most vulnerable people. I don't know how that happened. I do think that there's a structural disconnect. Polk is a health facility. It's licensed by the Department, by the United States Department of Health, and its head here is Rachel Levine. Let me go back to my notes. I'm just upset because I'm so appreciative you're listening, and I'm just so kind of done away by this panel that is so not understanding who I am and what I want or how we can achieve it. Let me go back to the notes. I apologize. Polk is a health care facility licensed by the United States Department of Health, inspected by Pennsylvania Department of Health, but the Secretary of Health is not here today to praise Polk, but instead we have people ready here to bury Polk, and that's a disconnect. It seems harsh, but I am really reacting to their insistence that we all must be compliant with their wishes. Otherwise, we have no value. It seems like looking for gold in a silver mine. I know the value that we have at Polk, and I know that the value that we add to the system of care. Polk and Whitehaven are first and foremost health care facilities. They're publicly run health care facilities run by the Commonwealth for its most vulnerable population as part of the state's original promise to take care of the most vulnerable population. And PED, on the other side, they set group home reimbursement rates for private pay providers, and they manage policy around that activity, and then that's inappropriate, but that is not health care. It's a service. It's a human service. And so there's this connect between what is health care and what is a service. I'm sorry that the doctor is not here to talk about how valuable Polk is, what extraordinary care is given there. As Sue said, we've been there for 100 years. We're in the 5th generation of caregivers, and the community supports that effort. I think that the problem maybe is between authority and power. The Department of Health has the authority to run the state centers. They're investigated by the health department. But the Human Services has the power to close down. And the difference between the authority to run the facility and the power to close it down creates a vacuum. And into that vacuum, indeed, has come the University of Temple Institute on Disabilities, who in the vacuum has become like a sole arbitrator of what is good policy and what is good form. Good ID policy is policy that they say is good policy. It was never, we were never thought to be a part of that. We were never asked to be a part of that. We were never considered to be a part of that, and that I think is really is the problem. Temple, in my estimation, has taken in more than $30 million over the last 30 years. They get hundreds and hundreds of thousands of dollars every year because they are an institute of the only thing in Pennsylvania, the Institute of Excellence. I think knowing that they get $30 million, you would have thought good form would have indicated to them to share some of that with us. But instead, they rail against our existence. They put so many more lobbyists on the payroll. It's me and Joe and Sue. You see us. You see us. That's who you got. I don't have stationery. I don't have a lobbyist. I can't invite you to dinner and get you a plaque. I can barely get the words out, for God's sake. You know what I'm saying? It's just us. That's all they are. Well, and the workers and the people here. I'm just saying, 24 lobbyists is a lot of lobbyists, even in a town that's got a lot of lobbyists. But what I want you to understand is that intellectual disabilities is a $3 billion business in Pennsylvania. And investing in lobbyists is a business strategy. Sherry was a lobbyist before she took over at ARC and is valued as a lobbyist because that's a swim. You need to be a lobbyist to get things prepared and get them going, or I don't know. We don't have lobbyists. I wanted to ask you.
Can I ask you to please
wrap
up?
I want to just say that there is big money, and I want you, because I think you maybe forgot to attend to all the money that there is in ODP. There's currently a $12 million contract that was in Commonwealth Court for a year. And it's a contract called CIS, and it says that we can move people from one category to another category, but it's not a service contract, and it's not even money to go to the waiting list. I'm just saying, in a business environment, there's a lot of money, and there's a lot of lobbyists, and there's a lot of slick talk, but we really are here to plead for recognition, and we thank you. Thank you very, very much for your ability to try to solve this problem for us. Thank you.
Okay, thank you, the three of you, for your testimony. If I call our next panel up, that's panel number 4 in the last panel. That's Darren Spann. from ASME, Bill Hill, who's the maintenance at Whitehaven Center from ASME, Tammy Lucy, who's a residential service aide at Polk Center and also an ASME. The three of them would come up, please. And I would also like to recognize, I think I've got everybody, Representative Kiefer is in attendance, Representative Schlossberg, Representative Struzzi, Representative Mert, and Representative Innamorato have joined us as well. Okay, we have only 2 testifiers. Okay. You can begin whenever you're ready.
Okay. Thank you, everybody, for having us. I appreciate it. I appreciate your time and looking into this situation. Members of the committee, my name's Bill Hill. I'm a maintenance repairman. I'm also the Whitehaven Center president of ASME Local 2334. I just want to say that this is a matter of right and wrong, life and death. There is, as we heard before, the transfer trauma and things of that sort. We, every day, take care of the individuals at Whitehaven and Polk Centers. We have the training that our aides go through, 6-week training before even in their homes, a 6-month probation. We have full-time LPNs and physicians and maintenance and everything of that sort. Our drivers, CDL trained. I mean, the care that we give, and I know we talk about price, but the more people that we put in to the facilities to be taken care of, that number comes down. And we all know that. That's just common economics. And this needs to be made right. We need to open up the centers. We need to take our most vulnerable citizens and help them. And I'm not disagreeing. There is people that are in the community and they're thriving and they can do very well. But there is some people that need our type of 24-hour, very, very excellent care, very hands-on. You know, also when you have your staff that's familiar. I mean, we have individuals that live at our facility that just the grimace on their face, our aides know what's wrong, even though they can't speak. There's that care. There's that everyday care. The individuals see the same people every day, and that care can't happen anywhere else. It really can't. And I urge you to look into this further and investigate everywhere you can. This has to be done. I thank you for your time.
Okay, Bill, thank you very much. And next we have Tammy Lucy, who's a residential service aide at Polk Center and also an ASME worker.
Thank you. Members of the community, my name is Tammy Luce. I am a residential service aide at Polk Center, and I'm also the president of ASME Local 1050. Thank you for the opportunity to hear our testimonies. I know Bill touched on it, but it can never be overstated. We are here for the individuals who we care for at Polk and Whitehaven. They get taken care of at our centers. They get everything they need. I can't imagine them out in the group home and not having what they have at our centers. I hear a lot of talk from DHS about community-based settings and empowering individuals to make their own decisions. Both of these points are disingenuous. What they need to remember is these state centers are communities within themselves, and they are crucial parts of the surrounding communities that they are a part of. This is home for these individuals. They have friends and family there. They have activities that they take part in. They have their own store at Polk Center. This is a community. I don't know what's so empowering about forcing them out of their home. This doesn't seem to be the residents making their own decision. The decision was made for them and for us as employees, and none of us were consulted, nor were the families of these residents. The way this was handled was a total disgrace and a slap in the face for everyone who lives and works at Polk and Whitehaven. If DHS wanted to go through with this, there was a much better way to handle this than the way they did. They need to reverse this decision and go back to the drawing board. There are more humane ways to balance the budget than killing our jobs and ripping vulnerable people out of the place that they call home. We are here as the voice of the individuals we care for. We are their voice, and they are our hearts. Members of the committee, please stand with us. Stand against this ill-advised decision to close these centers. Stand up for those who are unable to stand up for themselves. Do the right thing, please. Thank you.
Okay. Tammy, thank you. And we have our last panel, Marie Guntaferri, who is a residential service supervisor, qualified ID professional at Whitehaven Center and a member of SEIU, and also Bill Bailey, who's a psychological support specialist at Polk Center and also a member of SEIU. Marie, if you'd like to go first.
Thank you, everyone. My name is Maria Ferre. I'm a residential services supervisor, qualified intellectual disabilities professional at Whitehaven Center. I've worked there for 15 years. I am also the SEIU Local 668, thank you, Chief F5 Steward. Thank you to those of you who sponsored House Bill 1918 and those of you who have signed onto it. Again, I'm going to begin, as I've said over and over, we are not an institution. We are the home of 305 people. The residents of state centers are fully integrated into their respective surrounding communities. Participation in community service organizations. Everything that has been cited by the previous panel is offered at Whitehaven Center. All of it. We are members of the Lions Club, Chamber of Commerce, Knights of Columbus. We do roadside cleanup. Local businesses ask about our residents. We have forged the bonds in the community. Our residents' self-esteem is enhanced by our presence in the community. Those who cannot leave center grounds due to the extreme fragility of their medical status enjoy the many activities we bring to them: therapy animals, family visits, volunteer events, and religious services. As disturbing as it is, I need to remind you of DHS Secretary Teresa Miller's words on August 14th, when she referred to the closure announcement of Whitehaven and Polk Centers as, quote, an incredible moment in our history of Pennsylvania. Please remember that Whitehaven Center is situated on 192 acres of what is considered prime real estate. Mr. Kevin Dressler has already admitted that there are interested parties in regards to our site. Again, Secretary Miller and Deputy Secretary Ahrens, please remember their inability to provide any coherent responses to questions other than their usual evasive and canned rhetoric, manipulation of data, skewed statistics, and outright lies. Many employees of Whitehaven Center have been there for decades, upwards of 20 and 30 years, some even 40+ years. The average age of our residents at Whitehaven Center is 62. The average length of stay at all state centers is 47 years. What do these numbers say about the quality of care that we provide? There is a place for everyone to call home, whether it be a group home, life sharing, or a state center. Each person needs that individualized care tailored to their specific needs. For many members of the intellectually and developmentally disabled community, the most appropriate and least restrictive placement is one of our 4 state centers. I'm not going to rehash the waiting list. We've heard over and over about it. As was stated previously by our wonderful family members, people on the waiting list are not offered the option of a state center. So all 13,000 of them refuse services, even the 5,000 plus who are in crisis. I think that is ludicrous, that if anyone actually believes that. I can guarantee you that some of them would choose state centers if they knew they were available. Please know Since the closure announcement, Whitehaven Center receives 2 to 3 calls per week from families who are desperate for services and begging us to admit their loved ones. What does that tell you? That they don't even know that state centers exist? Another question from Ms. Landis. Why has the ARC of Luzerne County publicly stated that there are no current placement options and that they are very concerned about the welfare of our residents if Whitehaven Center would close? One of their own organizations. In conclusion, please keep Whitehaven Center and Polk centers open. Open the doors of our state centers to help these people on the waiting list who don't even know we exist, that the services are out there for them, especially 5,000 of them who are in crisis. As Ms. McCabe said, how did we get to this point?
Thank you, Marie. Next, Bill Bailey, you can begin.
Representatives and Senators, my name is William Bailey. I work as a psychological services specialist at the Polk Center. I'm also one of the chief shop stewards for the Service Employees International Union there. And I would like to address some of the points that have recently come up. I did submit written testimony. I'm not going to bother rehashing with it because, as someone earlier said, we all know you can read. My concern right now is how difficult this process is going to be for you. The state centers were created by acts of legislation, and in testimony you've heard comparing analysis. So people have talked about how studies done after Pennhurst closed 40 years ago showed that everything was so much better. In my Senate testimony, I actually cited the World Health Organization report from 2000, which showed people forced out of intermediate care facilities had an 83% higher mortality rate. So there was testimony given today that transfer trauma may not be a real thing. In the report that's being issued to the families, and this is actually part of the packet, I'd like to point out that they indicated of the 74 people who transferred from Hamburg, 13 have died in 32 months. So it's a percentage. If you do the same percentage with the 300 people between Whitehaven and Polk, you're looking at 48 people dying in the first 32 months after these facilities close. That's pretty high rate, and it supports that 83% higher mortality rate. As a chief steward, one of my biggest concerns has been the absolute lack of transparency from the Department of Health and Human Services. I brought up during multiple labor management meetings that we are not being told what's going on. Everybody seems to believe that this was a sudden decision that was made in August. In June of 2019, or in July of 2019, the Service Employees International Union was told that 2 individuals would be role released from their positions to cover what we were told were special state projects. We weren't told what those special state projects were. A month later, the closure announcements were made, and that's where we were informed that those 2 people have been role released to oversee the SIS assessments in the LP process. The processes are being used to expedite people moving out of the state centers and into the community. We also were just told that we have until December 31st to get those processes done. So the closure announcements were in August, and despite the fact that the Department of Health and Human Services is saying that this is not going to be done rapidly, that it will be done with compassion and according to policy, they seem to be expediting the process as quickly as possible. And no one's willing to sit down and explain why those numbers are happening. Every individual at the state center has an individualized service plan review once a year. I asked the question why we couldn't just do the SIS assessments and ELP assessments during their ISP. I was told the decision came from Harrisburg that they need to be done by December 31st. This is 300 people. There's a lot of disparity around cost associated. It's already been discussed that we have open beds at the centers. I work in a building that has 68 people currently in it. We have 150 certified beds just in that building alone. So we could double the population just in one building at the Polk Center. There are 5 buildings at the Polk Center that are currently have certified beds. If you add more people to the centers, the cost goes down. The per diem annually goes down. No one wants to address the fact that despite the proposals to support people in the community, no one's actually addressed how they plan on addressing the current 4,905 individuals who are on the emergency needs waiting list. That number went up by 200 over the last 18 months. That's available as public knowledge. I'm concerned because since August, the announcement in August took everybody by shock, but since that time, no one seems to be giving any information on what's going on. The House Bill 1918 really is looking at a moratorium to slow things down so that you, as the legislatures, can make a more informed decision. And I really, truly hope that that bill passes, because things are happening very quickly. Once December 31st rolls around, in theory, every single individual at the Whitehaven and Polk Center will have all the paperwork necessary to move into the community. I don't understand why this is happening with such quickness. To me, it doesn't seem like it addresses the needs of care. It seems to be more like something akin to human trafficking. That's all I have to say.
Okay. Thank you all for testifying. I'm gonna open it up now for questions, or if there's not questions, for comments. And we have about a half hour left, so what I'm going to do is ask the committee chairman, the four chairmen, if they have any questions first, and I would ask them to try to leave it to one question and keep it under 5 minutes. I'm not going to ask any questions, although I have quite a few. I'm going to ask Representative Zimmerman from the Health Committee first for questions and answers.
Thank you, Mr. Chairman. So I guess my question kind of revolves around the wrap-up here. So do I understand closure was and that information, you were given that information in August, and you're to be closed by December? No?
No.
Three-year plan, but all
Three-year plan.
all of the paperwork.
Please talk into the mic when you're answering questions.
In August, it was announced that there was a three-year plan to close the Whitehaven and the Polk centers.
Okay.
We had a testimony before the Senate, and after that, we found out that the SIS assessments and ELP assessments were expected to be completed for all residents of the two centers no later than December 31st.
Oh, okay. Okay. So, because it would clearly take time to get those residents taken care of in another way.
Yes.
Yeah. Okay. Thank you. Thank you, Mr. Chair.
Representative Madden?
Thank you, Mr. Chairman. I have a comment, and then I have a question for Sherry Landis. So I spent a number of years teaching children with intellectual disabilities, anywhere from a mild disability to a severe disability. And so I know that when we were working with a 20-year-old grown man who had cerebral palsy, who was blind, who was nonverbal, and it was time to change his undergarments. I was kicked in the jaw. It would take everybody in that classroom, and there were 3 of us, just to take care of that gentleman until it was, you know, we were done. And we had a number of children like that. So I guess my question is, how many people are you anticipating to each group home, and how many people do you anticipate will be taking care of those people? Just let me add one more thing, because I've been getting phone calls from my constituents who say, my son, one in particular who came to see me, brought tears to my eyes, said, my son requires so much attention that maybe after 3-4 hours the most, he has to be passed off to someone else because he just exhausts people. And I'm just trying in my head, trying to figure out how that works in a group home setting. If you have maybe 4 to 6 people in a group home setting, you know, what's the ratio? Is one person taking care of one person? Are there extra people for those people who require that extra level of care?
So let me first clarify something. So the ARC of Pennsylvania, even though we have some chapters that are providers, that's not the majority of our chapters, do not provide TSP. We do not, some have group homes, some have community programs, but we are not a provider organization, so I am not able to ask you what the ratio is. What I can tell you is that the group homes operate very much probably like Polk. And Whitehaven, there's probably a shift change. You know, I can't give you the ratio. And I totally people with significant and, challenges in the community. I think that Sue Jennings' point is well taken. But let me tell you that there are, for every person that's in a state center, there's a replicate in the community right now. I mean, we are providing the majority of care for the majority of people out there. So, I guess the question, because I keep hearing about this waiting list, the waiting list. The waiting list, if you're going to fund it, the bill says about putting a moratorium till everyone's off the waiting list. Do you know the fiscal code to that? It's billions of dollars. So if you're going to address the 700 people in Whitehaven and Polk, what are you going to say to who are waiting for care? Because you can't do both. The waiting list is not being helped at all.
And one quick question. The 13,000 people who are on the waiting list, every one of their families have been contacted, and every single one of them said, no, we don't want to go into an institution. We want to be in a group home. Every single one of them, including the ones in crisis. Because you did allude to the fact that they wanted to be in group home settings.
So once again, I can't speak for 13,000 people. I mean, there's a person that's...
Be respectful, please.
Well, that doesn't happen either. So I can't speak for the waiting list because Ned Whitehead is not here. But I can't imagine, and I think Kristen Aaron said that in today's are demanding more inclusion, and I cannot imagine that they're demanding getting in to a state center. I have employees that work for us with children with significant medical and complex needs, and they're choosing. Her biggest fear is that her daughter will end up in an institution once she passes.
Okay,
Thank you. Thank you, Mr. Chairman.
Representative Delicio, and please, I might ask to be...
Very short, Mr. Chairman. Two things in terms of a comment, Mr. Chairman. I'm hoping that we can sincerely develop a format here where a lot of good questions that I'm sure we have will be able to be funneled to somebody or some group and then get good answers that we can disseminate, and particularly where there's conflicting information. Or maybe the information is either accurate by omission or commission. I have extensive notes from this testimony, and for instance, I heard very clearly, perhaps I heard wrong, that only a court can admit somebody to an institution. So opening up the waiting list is not a court. Court is court. So lots of clarifications needed. The one thing I will comment on the legislation, since it's now running tomorrow and I do sit in the Health Committee, if we equate, and I have only spoken to one of the prime sponsors, not all three yet, but if the Medicaid waiver eligible individuals have received authorization, it only happens when funding is available, then this is not a moratorium as I understand moratorium. Because by my calculations, that task force would convene somewhere around the 12th of never. Now, I've been in this legislature 9 years, so I've sat through 9 budgets, and I am very familiar with the allocations that have been, and the fact that the waiting list also grows as well. So this, to me, is not a moratorium, and I am hoping that this task force will convene concurrently with this discussion and almost immediately, which will serve a lot of the needs that I've heard today. One, transparency, the other, the ability for significant input by all parties. As the chairman said, I appreciate this is not an easy discussion at all. Thank you, Mr. Chair.
Representative Toohill.
Thank you, Mr. Chairman. My questions are to be directed at to Deputy Secretary Ahrens, if possible. And I'd just like to thank all of you for availing yourselves of this very difficult hearing. I have just a number of short questions.
Sure.
Thank you. What is the estimated cost of the closure of Polk?
The long term, we will have savings from the closing of Polk. But during transition period, we are not anticipating savings. We're currently working with the appropriations staff right now, so we'll have the full analysis to the appropriations staff.
So there is a estimated cost to closure? You just don't have the number
During
yet?
the transition period, there will not be savings.
Okay, but there's...
savings will occur post-closure.
So there has been no estimation of what the closure for the Polk facility would cost?
The savings from it?
No, the cost of closure, for implementing closure. Is there a ballpark or an estimation?
We are currently working with the appropriations staff, so we'll have that full analysis shortly.
Would that be in the Senate or the House?
We're working with all of the appropriations staff.
And so then it would be the same answer for Whitehaven. It's just
Correct.
Undetermined, the cost of closure. And what is the cost for services of the 13,000 waiting? What's the estimated cost? If we, maybe you in the spring testified what that would be, the cost for us as the state to provide for the entire 13,000 on the waiting list.
So the thing to understand about the waiting, there's a few things to understand about the waiting list. First of all, the waiting list is 13,000 people. About 5,200 of those individuals are in what we consider the emergency category, needing services now or within the next 6 months. The types of services those individuals need vary. There are some of those individuals are looking for 24/7 residential type program. Some of those individuals are looking for supports with employment, respite care for their family members. So that varies. The remainder of the people of that 13,000 fall into two categories. One is critical, which means people need services within the next 2 years. And then we also have what's called a planning category. So people know they will need services within the next 5 years. So to do that analysis, you really have to take all of that into account. The other thing that we need to understand about the waiting list is only about 20% of people who have an intellectual or developmental disability are even known to our system currently. So we currently have about 57,000 people that are enrolled for services, but there are many more people out there in Pennsylvania that have a diagnosis, if we just look at census data and prevalence, that are unknown to us. So what we see with the waiting list is as people approach graduation from high school, we see that's when people come to us. So definitely the waiting list contains a spike around age 17, 18 when individuals and families are starting to prepare for that transition. So it is definitely a very dynamic waiting list, and what people are looking for varies tremendously.
That's very helpful. And is there, of the 5,200 emergency individuals, is there a ballpark number for the state looking at funding that? If the legislature, I mean, many of us are here today.
We can provide that for you.
That would be excellent. And you had mentioned in your testimony that there was a percentage of Hamburg employees who were, this is just on the staffing side, during the Hamburg closure, that there was a percentage that were offered employment, or they were specifically offered state employment. Can you?
By the time, by June of this year, every Hamburg employee that wanted state employment was offered state employment.
So would that be considered a cost shift and not a savings?
Well, I can only tell you about impact on our system. So we did have, some of those individuals did move to one of our other state centers. They moved to employment in one of our other state centers. Others moved on to corrections or the county assistance offices. So in terms of, I can only give you budget for ODP.
And just two more really quick ones. So we had the hearing in May with the Human Services Committee where Tom Kashadis from Whitehaven and Sharon McCabe from Polk and Susan Jennings, Whitehaven, had testified. Do you feel that that testimony had a negative impact, or that Whitehaven and Polk could be somehow considered to be more vocal advocates, and that then somehow translated into what's occurring today with closure?
No, the state, the decision to close state centers takes into account a lot of factors. So as someone who administers programs for ODP, we are constantly looking at all of our programs, and some of the things to take into account when you're looking at the 4 state centers are the age of infrastructure, the condition of infrastructure, the census, where admissions are coming from, any kind of hiring issues, the number of residents, cost per resident. So all of those things are taken into account, the needs of the individuals being served in each of those centers. So decisions about which center is really based on that combination of factors. To give you an example of age and condition, in terms of Polk Center, I think, some of the information that's hit the news is about the water treatment plant and how we're proceeding with this big capital project around the water treatment plant. But that's not actually even the end of the water problems that we have at Polk. We have had Legionella at Polk since December of 2018 and have been working to eradicate it. Our last series of tests, we still have Legionella
Secretary,
at Polk.
thank you. I have other people that want to ask questions, so thank you.
Sure.
Representative Toohill, thank you. Representative Mullery?
Thank you, Mr. Chairman. I had a whole line of questioning, but given the time, I'm going to limit it just to 2 that caused some head shaking by people who testified when Ms. Jennings testified. The first is for you, Ms. Landis. When you testified pretty adamantly that nobody from Hamburg Center ended up in prison or in the streets, I don't think it could be denied that some ended up in the morgue. When Ms. Jennings testified and said there was 15 of 80, you pretty vehemently shook your head no. So I'm going to give you the opportunity now to tell us why you were shaking your head no, and if you have a different number than that, please share it with us.
It's not about different numbers, Representative. It's about the average fatality with the people who live in state centers is approximately 5 a year. So when you take 36 months, it's 3 years times 5 is 15.
Okay. You are not in any way insinuating that transfer trauma is not real and will not have an effect on the people at Whitehaven Center or Polk Center, are you?
I'm not saying that transfer trauma is not real. I'm not a physician, and I can't say that that would. It's a possibility, yes.
You were present at the Senate hearing. We did have a physician there, and he talked about how real it was and the estimated number of deaths that would be expedited by the move, correct?
I was correct, because we were the only 2. I was one of 2 advocacy organizations that was allowed to testify at the Senate hearing.
Given your extensive history in this field, what has been your experience in the rate of transfer trauma with closures of this type?
I don't have an extensive experience in this field.
Does the ARC have an acceptable number or an acceptable percentage of transfer trauma deaths in the name of full community inclusion that is acceptable to the ARC?
Representative, no, there is no acceptable number of deaths, but look at the average age of people who live at the state centers, and some of these people are going to pass away. It's part of life. To directly point the finger at transfer trauma, I think we're all taking a stab in the dark. We're all looking at the numbers the way that we want to look at them.
Thank you.
I would be happy to...
I'm getting you next. The second head shaking I saw occurred when Ms. Jennings referenced Secretary Miller's work in Oregon. A quick LinkedIn check will confirm that both you and Secretary Miller had extensive work history in Oregon. So why, on her testimony to that, was your head shaking so much?
To my knowledge, Secretary Miller didn't work on ICF issues in Oregon. I did work on ICF issues in Oregon in the late 80s, early 90s.
And the CIS assessments that are being performed right now in the Commonwealth are being performed by KEPRO, correct?
That's correct.
Are you aware that KEPRO was the agency hired to perform the SIS assessments in Oregon?
I was not.
Okay. Are you aware that in Oregon right now there are multiple lawsuits against the state of Oregon and KEPRO for the way they are handling the SIS assessments?
I am not, and I'd like to know what that has to do with what's happening here with SIS assessments.
Oh, I mean, are you aware that every SIS assessment that was completed by KEPRO in Oregon that has been challenged has been overturned? In short, what I'm saying is that every assessment done by KEPRO in Oregon that said a patient's service could be provided in the community upon more closer inspection was deemed that it could not. Are you aware of that?
So KEPRO does not make recommendations for the state of Pennsylvania. For our contract with KEPRO is for them to administer a standardized normed instrument called the Supports Intensity Scale. We do this to the tune of about 1,000 people in our community settings each month. We have been applying this across our service system, including state centers. It is an assessment used in 20 states internationally that gives us a standardized way of looking at an individual's needs. It does not tell us how to meet those needs or where to meet those needs.
My last thing isn't a question, it's more of a comment. To hear you, Ms. Ahrens, talk about the factors that went into the consideration for these closures is extremely disingenuous. I mean, it is crystal clear, and I believe it was stated at a meeting in Whitehaven that the reason for these closures has nothing to do with budget. So to hide behind budgetary numbers is, again, the only word I can come up with here in a polite manner is disingenuous. This is a philosophical decision. I mean, is that something that you're willing to stand by today, that it is the philosophy of this administration that people should not be treated in institutional care, that they should be treated in the community, and this has nothing to do with budget?
Ultimately, the Wolf administration has been very clear that philosophically, yes, people should be served in their communities, close to their families. That was the driving force behind the decision here, driving force behind the decision to close Hamburg as well, driving force behind the incredible waiting list initiatives that this administration has put forth. But also budgetarily, it is unsustainable to continue to manage 4 state centers.
And that's where you went too far. And I would urge my colleagues on the Health Committee, the Human Services Committee, do not fall into the budget trap. This has nothing to do with budget. So don't buy into it. If you have any questions, don't ask them. This has nothing to do with budget. Thank you, Mr. Chairman.
Okay. I have 3 members that have asked, as Representative James, Representative Mert, and Representative Heffley. If I could ask them to maybe just limit their time to 2 minutes, maybe make a statement if that's possible.
Sure, no trouble.
Representative James.
Thank you, Mr. Chairman. I believe if there's a response to my comment/question, it'll probably come from members of panel number 2, which, just to remind us, includes the ARC, Temple, Disability Rights Network, KenCrest, and Envision. First of all, thank you very much for your advice on how we can take our $33 billion annual budget and appropriate it according to your wishes. We'll be sure and let the taxpayers know how you feel about voting for a tax increase. One of the first things we learn here when we come to the House is not to call into question the motives of any other member when he or she is talking on the floor. I detect a tone of negativity from panel number 2, which is usually the haven of people who are losing the argument, to besmirch the workers, the 1,100 workers of these 2 institutions by saying their only reason that they're interested in keeping them open is to save their jobs. That's the wrong thing to say. I have talked with the members out there frequently. I've never had a question about save my job. All the questions come, what's going to happen to Mr. X, Miss Y? So that part is wrong. You folks will go to the mats, literally, to defend the preferences of academics, nonprofits, and Department of Human Services people, but you won't even talk to the guardians of the people who live and thrive in these institutions. I don't know how you can justify that. You're welcome to try if you want to. The other thing I want to point out is a comment was made to me this morning by another member, I won't identify that person, that they actually talked to one of your folks from ARC who said, are you serious about you want to keep that center open just to save the job of a gas station attendant? I can't believe that was said either. Bad deal. At Polk Center, it's $134 million a year. $134 million a year that goes into our economy. 740 people are going to have one dickens of a time trying to find employment. I don't really think you're going to be able to fill those bills. So you're welcome to.
No, we're not going to allow you to answer the question. I'm
No, he's saying no.
up against time, and I can't allow
Okay.
you to answer the
So
question.
I guess I'm done. Thank you.
Thank you. Representative Mert for just a brief comment.
Thank you, Mr. Chairman. This will be a statement. Mr. Chairman and members of the committee, I concur with the speakers that talk about the quality of life in the state centers. I visited every state center, some 2 or 3 times. I was at Whitehaven not too long ago, met with Mrs. Jennings and Mr. Kashedas and so forth. And I would certainly encourage the members of this committee to visit these centers as well, so you know what we're talking about here, and you know what the dynamics are. You know, when we're listening to all the testifiers and so forth, you know, sometimes I ask rhetorically out loud in my mind, what problem are we trying to address here? This is a system that works. This is a system that delivers care with compassion. And, you know, the one thing I didn't hear today, because I came in late, but I'm sure it was said, you know, for many of the residents of the state, at the state centers, our staff that care for them are family, because some of them don't have family to visit them. Whitehaven is a long way from Philadelphia, especially on public transportation, and many of the families just cannot come and visit their loved ones at Whitehaven, or at Polk for that matter. And this is the last thing I'll say. We really want to address this in a meaningful way. We have to fund the waiver program, and we have to fund programs and services for adults with special need. Every year during the budget cycle, we grovel, some of us beg, some of us plead for more money to take care of adults with special needs. The one population we didn't talk too much about today are the Pennsylvanians who have intellectual disabilities or developmental disabilities, who are adults, some 60 and 65 years old, who live home and are cared for by their parents who are 90 years old. I kid you not, this is in every legislative district. And what are they waiting for? To get a placement into a group home? They're waiting for one of their parents to die. And this is a very, very sad reality, a painful reality. But this is something that we have to address. And I hope all the elected officials in this room, my colleagues, I hope we remember this conversation during the budget hearings for the next 6 or 7 months, when we're begging for more money to address this crisis. The last thing I'll say, for any family members like Mrs. Jennings or Tom Kashedas or anybody who has a loved one in the system, if this is where you want your son or daughter, this is where they belong, and we should be making that a reality. Thank you.
Representative Heffley for brief comment.
Thank you, Mr. Chairman. And this is one of numerous hearings we've held on this issue, so I want to thank you for your leadership on here. And just to follow up with the philosophical question earlier, or the statement that this is a philosophical difference, I would just say that, as Representative Mert had suggested, these folks have chosen to be in these facilities. They don't have to be there, right? There are some options in the community, but just to say that now we're going to force them, we're going to take that option away. So we are taking options away from them and their families, because this is a level of care, and a lot of these folks have been through the system already, and this is where they settle, this is where they're going to get the best care. My other concern is with the mental health. Some of these individuals need this type of care, and they need to be in this type of facility, and when you put them in another setting, it could lead to issues with the criminal justice system, or some of these folks just need that type of care, and I'm very concerned of that. I was actually contacted by a woman in my district, an elderly woman who her son was in one of the state facilities, and she was deathly afraid of him getting released into another setting because of threats that he had made, and she had done everything for her son and found that this was the best for her and also for the safety of her family because of the conditions that he had. So I think that those need to be taken into consideration, and I would hope that that it's not just about a philosophical difference. This is about individuals and the level of care that they need. So I think that they should be put first. It's not about the economic impact that these facilities have in the community is very important, but at the end of the day, my concern is for those individuals receiving the care that they need. So thank you, and I hope that will be the number one consideration as we move forward.
Okay, thank you. I'm sorry, we have to, I want to just make a quick comment because we have to be up on the floor at 1 o'clock, and it is just 1 o'clock now. I want to thank everybody for their testimony today from both sides. And my comment is that there's a bill, it's a moratorium bill, it's House Bill 1918. I know the Senate has a similar bill over in the Senate. The bill in the House was sent to the Health Committee. And from my perspective, if the bill comes out of the Health Committee and comes up for a vote on the floor after what I've heard today, I am a yes vote on that bill. So with that, I'd like to call this hearing of the Human Services and Health Committee and ask it be adjourned. Thank you.